Hello, I'm Aimee Allbritton, one of the Senior Vice Presidents here at Memorial Health System. And during the COVID-19 pandemic, I'm serving as our organization's Public Information Officer. We've been doing a series of video called COVID-19 Conversations to help inform you, all of the community, about what's going on in our health system and in our community related to COVID-19. I'm here today with Ed Curtis. Ed is the President and Chief Executive Officer for Memorial Health System. Over 45 years experience with Memorial and leads our organization. He's currently serving as the Incident Commander for the COVID-19 pandemic as well. Ed, thank you for being here today.
Thank you, Amy, for having me.
Would you take an opportunity to share with the community what you would describe as the current state right now that we're experiencing within the regions that we serve?
Yeah, I'm standing here today on the middle of April, and we're about 45 days into standing up our incident command structure. Now, I want to let the community know, usually when we have some storm or some disaster that occurs, we may stand up an incident command structure for 3 or 4 days, but we're 45 days into this. So we've been at it a long time, and I think if you look at the current state of the pandemic right now in Central Illinois, we have community spread. It's in our community, and that started out with people that were traveling in from remote areas that were New York, Florida, other areas, and spread it to another human being. But over time, it's gotten into the nursing homes, it's gotten into some of our prisons, anywhere where you congregate large numbers of people, but it definitely is in the community here in the middle of April.
And we're seeing that in a variety of different ages as well, right?
Yeah, we've had a positive patient at 18 all the way up to a 99-year-old that you may have seen in the public media that was discharged from one of our 5 hospitals here this past week and is doing quite well.
Yes, and we're seeing cases both as inpatients or individuals who are sick, so sick that they need to be hospitalized, and then we're seeing cases out in our community of people who are more what we tend to call the walking well, and they're well enough to be at home to get their care. Can you talk a little bit more about that?
Yeah, so early in March we stood up 2 respiratory care centers, one in Decatur, Illinois, one in Springfield, Illinois, for the simple purpose of capturing patients in an ambulatory environment where we could test them prior to coming into a physical facility, and we could protect our staff and protect the patients as well. To date, we've tested 2,000 people here just through the Memorial Health System, and we're seeing over the last 7 days, which is really the most relevant, about a 4.4% positive rate. So very encouraged by the low amount of positive rate, but there's a reason for that.
And what is that?
Well, I want to give compliments to the community because it's really about sheltering in place. It's about good hand hygiene. It's about keeping your hands away from your face that on average we touch 60 times an hour. It's just amazing the work that's being going on in the community. But sheltering in place is making a difference. We also live in a geographic region where we're a little bit more spread out than you're going to see if you're in the inner city of New York or even on the south side of Chicago. We have a lot more room, so if people do shelter in place and they do good hand hygiene and they're careful, we can keep our spread down to a lower level in Central Illinois.
And that's really important as we look at this concept of flattening the curve, right? Because part of what has been going on all around the world is trying to make sure that the healthcare organizations have the time and the ability to spread out the people that they're taking care of. And one of the key components of that is utilizing personal protective equipment to make sure that those care providers are safe as well. Can you talk more about what we call PPE or personal protective equipment and where Memorial stands? Because we do see some stuff in the media or on social media, people hypothesizing that we don't have enough. Can you talk to us about what Memorial has?
Yeah, I'll tell you, we have an amazing materials management operation throughout our health system. We have 5 hospitals, we have 79 sites of care when you add all the ambulatory sites of care, from home services to behavioral health to physician practices throughout Central Illinois. But because we have such a sophisticated materials management division, Aaron Bromley, that leads that area, was coming to us really in mid-January when I couldn't even pronounce COVID-19 and saying, hey, we need to be aware, we need to be protective of our PPE, we need to be stocking up on our PPE. And she started doing that well in advance of us setting up our command center on Monday, March the 9th.
Okay. So when we look at PPE, we have enough for the people who are here providing that care. We're still utilizing conservation efforts. So one of the things like postponable surgeries that have declined, or bringing individuals into the facility, visitors and things like that, all of that's done as part of the effort to conserve that PPE, so when we have it, when we need it, we have it.
We did it to conserve PPE, but we also did it to honor the shelter in place. Because if we're bringing people out and moving around the community, even for an ambulatory procedure, there's a potential risk of spread. Not because of our health system's contaminated, it's not. It's just we need people to shelter in place. So if you took our whole operation and organization, we're down about 50% our business. Inpatient care, ambulatory care as a result of sheltering in place, canceling elective procedures, pushing things out. That doesn't mean if you need health care, come see us.
Right.
Go see your physician. We're doing any urgent surgical procedure, anything cancer related. Nothing is being deferred for people that need that essential services. But as a result of this shelter in place, conserving PPE, we will never run out of PPE for any of our healthcare workers or patients or family members that are allowed in special circumstances to visit. We have an adequate supply, and we're constantly sourcing additional PPE on a daily basis, working with our colleagues throughout Central Illinois, but we have adequate PPE.
And that's a great point, Ed. One of the things that we've seen be really effective through this COVID-19 pandemic is the healthcare organizations in the community working together. So our colleagues at SIU School of Medicine, at the Springfield Clinic, and HSHS Illinois are partnering. We've been partnering in a lot of ways in the past, but partnering in even new and unique ways around purchasing and communication. And can you talk a little bit more about that, how that came to be, and what you think the benefits are of that?
A lot of things are so surreal about this pandemic, and things that I never thought I'd experience in my lifetime, certainly in my 45-year healthcare career. But one of the things I'm most proud of is just the spirit of cooperation that's occurred between all of our healthcare providers. There's nothing we're not in lockstep with our competitor. If you look at HSHS as a competitor, working closely with the Springfield Clinic, the medical school, we're all lockstep in gathering PPE, communicating information, sharing data. It's very reassuring to the community, knowing how closely we're all collaborating and working together.
And we're constantly hearing about that. Even this morning in our command center meeting, we heard about a purchase of N95 masks that are coming in that we were able to buy in bulk because the 4 organizations were partnering together, and that allows the vendors to pay attention, if you will, and give us those large bulk orders and give us what we need. So that's just one of those benefits. Let's talk a little bit about the command center. So you mentioned earlier this idea of we stood up incident command. For people who aren't familiar with that concept, it's kind of a whole new language and a whole new way of operating, since it's not business as usual here anymore. How would you explain to the community the incident command structure and what that means for our organization right now?
So it's a great question, but it really is based upon the ability, forget about organizational structure, organizational roles. They're very clearly defined roles in a health system incident command structure for dealing with disasters. And so therefore we, as I said, you're going to have a logistics chief, you're going to have an operations chief, you have medical liaison, our infection prevention people are going to be looking at the data. You serve as our public information officer. We have a hospital division, an ambulatory division, all safety officers, so important. A planning officer, because we're doing longitudinal planning, looking out to make sure we don't run out of not only PPE, but intensive care beds or ventilators, all the things you're hearing in the national news. And I want to reassure you, we have every bit of that in place, as well as HSHS does, working closely together. But it's all because this incident command structure that we are very prepared as an organization.
And that incident command is a group that meets virtually on a regular basis. Can you talk a little bit about how that works and how we then cascade that information out to our leaders and our colleagues?
Yeah, so since the 9th of March, that group is meeting on a daily basis. We have a command center meeting that lasts about 1 hour from 10 to 11. As Aimee said, it's a virtual meeting where we can broadcast into our communities of Decatur and Jacksonville and Lincoln and Taylorville, as well as Springfield and other ambulatory sites around the health system. So everybody participates if you're on that command structure. We do that daily. We summarize that through our public information officer, a written document at 6 a.m. every day to our 10,000 colleagues, our 1,000 members of the medical staff, other community leaders. We're issuing a daily update in terms of what's going on in healthcare, what's going on at Memorial Health System relative to this COVID-19 pandemic.
And what about for our leaders? Because they're an important source
Absolutely.
of information for our colleagues. I think one of the things that we talk a lot within crisis communications is that when people don't have information, they tend to fill in the gaps with their own information, which sometimes isn't always accurate or reliable. So we want to make sure our leaders are up to speed. Can you fill them in a little bit on what's going to happen here at 3:30 today and every day at 3:30?
So every day, at least Monday through Friday, we're having a leader daily conversation. And that's 500 leaders throughout Central Illinois. As I said, we operate 79 sites of care. Every leader is required to virtually sign on to that meeting. They're watching it live streamed. I lead that meeting every day. I invite a different guest in. Today it's going to be human resource staff talking about issues of
Colleague health.
We're going to talk about benefit structures. We're flexing a lot of staff into new roles in the organization. And all of these things we talk about on a daily basis. Yesterday, we talked about testing. You know, how are we doing about testing for COVID-19? So every day we have another subject that we talk about within the leader daily conversation. I think it's been very helpful, and it's also taped. They can go back and watch aspects of it later. We have a wonderful communication tool called Workplace, and it's available to all 10,000 colleagues in our system. They can get it on their phone, they can get it on their computer, but it works just like Facebook, and it is produced by Facebook for employers, and it's only for employers, and it's a valuable tool for us to communicate with our workforce in real time.
Yeah, so we can share out videos and have a couple thousand people watch them within an hour. It allows them to ask questions, you to be able to share information, and really puts the subject matter experts right at the fingertips of all of our colleagues. And so working to communicate as much as possible. So Ed, as we start to wrap this up, I'm curious, what worries you most about what's going on right now in the COVID-19 pandemic?
So in Central Illinois, I worry most about the community, which has done an extraordinary job with sheltering in place, but I worry about complacency setting in. I worry about messages you're hearing nationally from the president about kind of reopening the economy in waves, and I get it. I understand the economic impact this has had on us, but we don't have a vaccine. We don't have a treatment for this right now. It's easily spread, air droplets, and if people just get complacent with sheltering in place, hand hygiene, keeping the social distancing, that is going to will allow us to see another uptick in the spread, and that really worries me. And I know people are frustrated with the length of time that the shelter is in place. I don't think we can lift it at the end of April personally, because we don't have a vaccine in place and won't have for a while. So we're going to have to be very careful about relaxing it to the point where we even have large congregate settings, like 250 people at a meeting or at a church service or at a sporting event. We're going to have to be very slow until we have vaccines and treatment available. That worries me.
Yeah, that's understandable. What about if we flipped that coin over? What are you most proud of?
Well, clearly the colleagues that work in healthcare, what I will call our first responders through the Memorial Health System, people that are out in the community, people that are stepping up to care for those that are afflicted with this virus that need care. And I'm just really proud of the teamwork, the collaboration, the cooperation that's occurring across healthcare organizations. It's humbling for me, and it's a privilege to be part of this organization, this health system, and it's just amazing.
It is, it is. So one last question for you. One of the things that you talk to our colleagues here at the health system about is this concept of healthcare being local and people wanting to get care where they live. And when you talk about that with our colleagues, you often talk about your parents and how both of your parents are here living in our community. And then we also know that you have grandchildren that we hear you talk about quite a bit. So you're going through what everyone else is going through. Do you have any tips or advice for how are you dealing with not seeing your mom and dad? How are you doing with not seeing your grandkids?
Yeah, that's tough. I'm blessed because I'm a native of Springfield. I have my two parents alive in their 90s, and I have my mother-in-law alive. So we have four senior citizens, our family, that are in their 90s that are living in a retirement home. And I'll tell you, they're sheltering in place perfectly. The institution there is rigid about no visitors, not letting people in or out. And that is so important for these people that are living in large congregate settings. So just FaceTime, those kind of activities, that's it. And it's tough for them, it's tough for us because I'm used to seeing them on a regular basis. Now, my adult kids live in the community. I'm blessed to have 4 grandchildren from ages 3 to 9. And we're sheltering in place from them. We are not seeing them. They are, we can drive by and wave to them, in the yard, but at a distance. There's none of this going in the house or social distancing, so it's hard on them. First time they've experienced anything in this lifetime, first time for us. So it is challenging for all of us, but I'm following the same rules that everybody else needs to follow, and there shouldn't be any exceptions of that. I'm most worried about these congregate settings, long-term care facilities, prisons, where there's large number of people living in close proximity. That's where we have the greatest chance for spread of the virus.
But your grandkids someday will, just like right now we see individuals that are, in their 20s and 30s, they remember being in school when 9/11 happened, and that's kind of a marker for their generation. Your grandkids, this will certainly be one of those things that is a whole different experience for everyone, but they're learning a lot of new skill, right? Is your mom learning how to FaceTime and communicate? So there's certainly a lot of challenges, but it's looking for the bright spots and trying to find new ways to connect with those people.
And I have one final comment for our community. If your hands are so dry that you're constantly reaching for lotion, then you're doing a good job with your hand hygiene. If they're not, you need to wash your hands more.
That's a good point. Very good point. Okay, thank you, Ed, so much for sharing with us. We know that your time is pretty taken up with COVID-19, but making sure that we get reliable resources of information out to our community is so important. So we thank you all for watching, and we'll be back soon with an additional COVID-19 conversations. Thank you.